So today on the Senate floor, there was an attempt by Ohio Senator J.D. Vance to make sure our government does not repeat the mistakes of the last pandemic.
We cannot return to the failed policies of the COVID pandemic. I'm not mad that we screwed up. I made mistakes. Many people in this body made mistakes. What I do think that we should avoid is repeating the mistakes in 2023. Let's learn from the mistakes that we made instead of just doubling down on them.
No surprise, that effort failed. Why? Because COVID has become, well, a convenient political tool. As I mentioned at the top of the program yesterday, the head of the World Health Organization warned of, quote, concerning trends for COVID-19 ahead of the winter season. He said that, quote, the increase in hospitalizations and death shows that COVID is here to stay, end quote. Well, we talked about that yesterday. Just learn to live with it. My question is, looks like they're setting the stage for Act Two of this tragedy. Joining me now to discuss this and more is academic clinical trialist and epidemiologist, Dr. Andrew Bostom. Dr. Bostom, welcome back to Washington Watch. Great to see you.
Good to see you again, Tony.
So, does it look like we're getting set up for the same thing we saw last time around?
Oh, absolutely. And I have a feeling it could be even worse next fall when we're right in the middle or coming to the final stages of the election cycle. I was very impressed with the bill that was put forth. And it's disappointing. I'm just learning from you now that it was not, that it was not accepted, because we know that these draconian restrictions not only failed in terms of reducing the spread of COVID and its accompanying morbidity and mortality, they had catastrophic socioeconomic consequences. So the idea that we might repeat basically what's a Chinese communist policy of control is just really shocking and abhorrent.
Well, speaking of Chinese communist control, the World Health Organization, which seems to be under the thumb of the communist, remind our viewers and listeners how well they did last time in handling the pandemic.
Yeah, they got whether it was through ignorance or deceit, they fundamentally mischaracterized the basics of transmission. They initially were skeptical of masking, but then, of course, embraced it. They oversold the vaccine. Fundamentally, just like our CDC, they got everything wrong. There's no other way to explain it, Tony.
So how do we chart a course forward, knowing that COVID is real? It's here. I'm not a denier of the fact there's COVID, but the flu's here too. Everything else is here. We can't live in fear of these things.
Well, exactly, and we have to realize that, first of all, even at its worst, the original Wuhan strain Alpha, which came afterwards, the infection fatality rate, the number of deaths caused actually by COVID over the total number of infections was grossly exaggerated. It wound up coming in very much like some of the pandemic flus we've had in the past, not the horrible one in 1918, but 1957, 1968, around 0.25%. So that's not 2%, 3%, let alone 5%, 10% that was being sold at the outset. That is very manageable, as we've seen from recent history. Again, 1957, 1968, where none of these draconian measures were deemed necessary, and it was also very age and comorbidity specific, Tony. It was not targeting the young, healthy, working population, basically people under 70, who comprised 94% of the world's population. The idea that they would be thinking along these lines again of restrictions and mandates, again, just is very anti-scientific, I have to say at this point.
So let me ask you this final question, Dr. Bostom. So we know the government's not going to change course. They're going to repeat, it appears, the same failed policies they did before. Has the medical community learned anything? Are they going to take a different approach?
Some have, too many haven't. I think it's going to be up to the public, Tony. I think there has to be informed, passive, obviously peaceful, but stout and resilient resistance to this. And I think, it can start in schools. I mean, we're slowly seeing the idea of mask mandates for children who are at such extraordinarily low risk from COVID, actually lower risk than from seasonal influenza. And I think parents have to stand up, just as they were upset about what kids were learning in school, and that came through during the lockdowns, with getting a window into home school teaching that was going on electronically. They have to just say, no, my child's not going to be masked in school. I'm not going to accept a COVID vaccine as a passport to getting entry to the school. There has to be active public protest against these measures.
In other words, we shouldn't be lemmings this time around.
Absolutely not. Absolutely not.
Dr. Bostom, always great to see you. Thanks so much for joining us today. I'm sure we're going to be talking in the days ahead.